Confused by your vet's recommendation for diagnostic scans? I don't blame you. It can get very complex very quickly. In this video, I'm going to go over radiographs, ultrasound, and MRIs so that you know what each test means for your cat's health. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. When you take your sick cat to the veterinary clinic, you know you're going to be met with recommendations for diagnostics. There's blood work, there's urine samples, there's blood pressures. There's also diagnostic imaging, which are those radiographs, ultrasound, and MRI. But when your vet recommends a specific diagnostic test, it's not uncommon to wonder, why? Why that one? What's the difference? And is it really necessary? These are excellent questions, so let's dive in. Let's start with radiographs, or what most people call X-rays. This is a really widely available diagnostic tool. A radiograph, or an X-ray, is basically a photograph of the inside of your cat's body using radiation. They're especially good for looking at bones, the chest cavity, and the overall size and shape of internal organs. So let's say your cat has kidney disease, and we're concerned about how large or small the kidneys are. On X-ray, we can't see the fine detail of the kidneys, but we can look at their size, we can look at their location, and we can decide, are there one or two? Sometimes we'll also see an unexpected shape or shadow that makes us concerned for other disease processes. We also use X-rays to check the chest and lungs. For example, if your cat with chronic kidney disease is suddenly breathing faster, we may do an X-ray to look for signs of heart disease or fluid in the lungs. Using a non-medical analogy, think of X-rays like a picture of the forest. With X-rays, we can see the forest, we can see there's lots of trees there, but we may not see the insects and the animals hiding in those trees. X-rays are quick, relatively inexpensive, and give us a big picture overview. But they're limited. They can't tell us much about the internal structures of soft tissues. That's where ultrasound comes in. An ultrasound uses sound waves to create a live, moving picture of what's happening inside your cat's body. If an X-ray is a still photograph, think of an ultrasound more as a video. It lets us look inside the soft tissues in real time. Back to our CKD example, if we want to know why the kidneys are small or whether the internal structures look normal or scarred or inflamed, ultrasound is the tool we use. It lets us see changes to the kidney tissue in detail that an X-ray never could. As a personal example, I had a cat at one point that when I did his abdominal palpation, I thought I felt a mass near his bladder. So we did an X-ray to get an overall picture. And sure enough, there was a strange structure located right next to the bladder that should not have been there. But we couldn't tell what it was with the X-ray. So the next step was we did an ultrasound. Lo and behold, when I put the ultrasound probe on that strange structure, it was actually this cat's kidney. So he had one kidney in a normal location, and he had a second kidney right next to his bladder. Good news, it looked totally normal, and it was a cancerous mass like I thought it was, but I needed both tools to know exactly what I was dealing with. Ultrasound is also great for evaluating blood flow and guiding procedures. For example, if we need to take a sample from the kidneys or the liver or even the bladder, an ultrasound helps us guide our needle into the right position. And beyond CKD, ultrasound is important for helping us to detect things like heart disease, liver changes, intestinal disease, fluid in the abdomen, or even lymph node changes. An ultrasound specifically of the heart is called an echocardiogram. There are a couple of things to know though. Ultrasound requires your cat to stay relatively still. So for some cats, this means using a light sedative to keep them there, particularly if they're painful. We also need to shave the fur in that area to get the best image. So if your cat comes in for an abdominal ultrasound, they're going to have all of the fur shaved on their belly so that we can get the best images. Going back to the forest analogy, if the X-rays give us a big picture that there's a forest with trees in it, the ultrasound lets us look at the leaves and potentially the berries on those trees. flow technology could also let us theoretically look at the sap that's moving through the trees. It's the best way to look at the fine details of the soft tissue, look at fluid, and sometimes get tissue samples. Lastly, let's talk about the test that usually raises the most eyebrows, and that's MRI. MRI stands for magnetic resonance imaging. Instead of using radiation or sound waves, MRIs use a powerful magnet to create incredibly detailed pictures of soft tissue. For senior cats, we don't use MRI nearly as much as we use X-rays or ultrasound because it's a relatively specialized diagnostic modality, but there are times when it's the only test that can give us the answers we need. For example, if a cat is suddenly showing us neurologic signs, like seizures, stumbling around when they're walking, blindness, an MRI is often the best way to see what's going on with the brain or the spinal cord. Neither X-rays or ultrasound can show us those structures in enough detail. The downside, MRI requires full anesthesia. It's more expensive, and it's typically only available at specialty clinics. But when we're trying to get answers about the brain or the spinal cord or anything neurologic, nothing else compares. So think of MRI as the deep dive tool. It's definitely not something we reach for in every case, but it is essential to get the answers we need in very specific cases. So let's tie all of this together with a case example. Imagine you take your senior cat in with CKD because they've been losing weight. First, we may take some X-rays to look at the kidney size and location, take an image of the chest, and get a broad overview of what might be going on. If we want to look closer at the kidneys themselves, or the bladder, or even the lymph nodes, we'll recommend an ultrasound next. That helps us see that kidney tissue. Is the kidney tissue normal? Is it inflamed? Or maybe is there even a blockage because there's a stone present? If, then on top of all of this other stuff, your cat suddenly develops seizures or other neurologic signs, an MRI would be recommended to check out the brain and the spinal cord. Each test has its place, and they often complement each other. So it's not about one test being better than the other, it's about using the right tool to get the best answers. The more information we have, the more specific our management or treatment strategies can be. And I get it. These recommendations can be overwhelming, particularly if you're already dealing with a sick cat. But remember, each test helps give us clearer answers, and clearer answers means better decisions for your cat's health and quality of life. If this video helped you, I invite you to check out my other videos where I break down complex topics in cat health, particularly chronic kidney disease, into clear, practical steps you can use right away. Thanks for watching, and I'll see you in the next video.